Welcome back. I'm the Intense MD, a double board certified intensivist, here to give you an inside look into the intensive care unit. Today we're going to talk about code status. A code status tells us what somebody in the hospital wants and does not want in case of an emergency in the hospital, if their heart should stop beating or their lungs stop breathing. There are primarily 3 different code statuses, and I'm going to talk about each of them right now. So if somebody is full code, this means if their heart stops beating or their lungs stop breathing, they want resuscitation measures and to be placed on life support. So this includes being placed on a ventilator if they have trouble breathing, chest compressions and emergency dose drugs if their heart stops. If their heart is in an abnormal rhythm that is shockable, we deliver a shock to try to get their heart back into a normal rhythm. So somebody who is full code status means that they want all of these things done in case of an emergency. If somebody's code status is do not resuscitate or DNR, this means if their heart stops beating, they want us to let them die naturally without any life-saving interventions. So we do not do chest compressions, we do not do any shocks, we don't give any medications, we let them die naturally. This does not mean do not treat. There's a common misconception that people who have a do not resuscitate, a DNR, means that they do not want treatment. That's not true. If somebody's in the hospital getting treated for, say, pneumonia, and they tell me that they are a do not resuscitate, we give them antibiotics, we supplement their breathing with oxygen, and we work towards reversing their illness. If any emergency happened and their heart stopped beating, we know they don't want anything done beyond that point. Something that typically goes hand in hand with the do not resuscitate is a do not intubate. Intubation is the process of putting the breathing tube into the throat to place somebody on a breathing machine. So this simply means somebody does not want to be on a machine to help them breathe. So they are DNR and DNI, which means do not resuscitate and do not intubate. The final code status is called comfort measures only. There are other names for it, but most of the time it's referred to comfort measures. And this means that the patient does not want treatment. They just want any care aimed at making them comfortable, knowing that they are most likely going to die from this disease process. This is typically a code status somebody opts for at the end of their life. Our aim is to treat their symptoms rather than the disease process. For instance, if somebody opts for comfort measures only or their family opts for comfort measures only and they're on life support, we withdraw all life support measures, any life-sustaining drips, any machines such as the ventilator, and we allow them to die naturally. And in this process, we focus on their comfort. So if they appear that they're in pain, we give them medications for pain. If they appear that they are anxious, we give them medicines for anxiety. If they look like they're having difficulty breathing, we have medicines to give them to ease their breathing. The whole focus is to make the patient as comfortable as possible while they're dying. So who decides what a patient's code status is? Many times it's the patient themselves. So if a patient is able to communicate with the medical team, when they come into the hospital, we ask them, if your heart stops beating, do you want CPR, chest compression, shocks? If your lungs stop breathing, do you want to be placed on a ventilator? If a patient is not able to communicate with us because they're already on life support, or if they're too sick when they're coming into the hospital, or any other reason, we will ask if they have a medical power of attorney. And this is somebody who they've elected to make medical decisions for them. And if they do not have a medical power of attorney, we look for their next of kin, which is typically a family member. We'll discuss more about medical power of attorney and next of kin in next week's video. So when is code status decided? So like I said, every time somebody is admitted to the hospital, they're asked. Even if I was admitted to the hospital, I would be asked, what my code status is. But I think it's never too early to discuss these things with your spouse, your family, your close friends, whoever would be making medical decisions on your behalf. If you cannot speak for yourself, I think that you should at least let it known what you do and do not want in case of an emergency. It's also good to ask people who you may be the medical decision maker for, such as your parents, your spouse, your siblings. If you are the medical power of attorney for somebody, hopefully you know what they want. It's not an easy discussion. A lot of people don't like talking about it, but I think it's very important just so everybody's on the same page and there's no surprises. So this was a short one, but it is to set the foundation for what we're going to talk about in the upcoming videos. If you have any questions about code status, please leave them below, and I'll see you on Friday.